everybody. Thank you for coming out and being my audience for tonight. As you know, my name is Linda Sayavon. I graduated in 2004 from the University of Arkansas at Fort Smith with an Associate of Applied Science degree in dental hygiene. I have been practicing for 9 years in private practice, focusing mostly on clinical hygiene. Until recently, I started volunteering more in community dental clinics. In community dental clinics, you see more patients from different aspects of life who don't have the means to go to the dentist, they can't afford dental treatment. So you start to realize that some people don't even know they're supposed to brush twice a day. That brings me to the topic of discussion today, which is the importance of dental care. Before we start, I'm going to hand you a note card with some pens, and you're going to put down your name and your daily routine. Do you brush twice a day? Do you brush in the morning, brush at night, brush after meals? And be honest. You don't have to write a lot, just tell me what you do.
Can I have a new pen?
Wait, when do we brush?
Just tell me what you do when you wake up, after meals. And after you do that, just put the card to the side. And I'm going to tell you the importance of dental hygiene visits. How many of you go to the dentist regularly? 2 out of 5. Okay. And that's not uncommon. A lot of people don't go because they don't have the insurance, they don't have money, or they're scared. They don't go when they're in pain. What I want to talk about is the importance of when you do go, they check for cavities, they check for gum disease, we check for oral cancers on your cheeks, tongue, throat, and we also teach you how to keep your teeth clean. And in the way that you keep your teeth clean, it prevents gum disease. How many people, when you brush and floss, do your gums bleed? Okay. Why do you know why your gums bleed?
Because I don't brush them.
No, you don't floss.
Oh, yeah. That
Both. When you don't brush or when you don't floss, the bacteria. You ever wake up in the morning and you feel the fuzzy stuff on your teeth? Sometimes. That's called plaque. When there's too much plaque, your gums become ulcerated. So when you brush and floss, you nick the ulcer and it starts bleeding. Brushing and flossing also helps prevent gum disease along with dental decay. Dental decay is a dental professional's term for cavities. Cavities start by the plaque mixing with sugar. When sugar and plaque mixes together, you get holes in your teeth. So the acid dissolves the enamel becomes soft and forms a hole. Your home care has a lot to do to prevent that. Like I said, proper brushing, flossing, family history. Do your parents, did they ever teach you how to brush properly? Did they ever teach you how to floss and eat right? All these little factors are very important. Now, did you know some of you ever get dry mouth? Do you ever feel like you don't have enough saliva?
Yes, I work. You talk.
When you talk too much, right. When there's not enough saliva, you don't have any buffers for the acids that form. So you get cavities faster, and you also, for some reason, when you don't have enough saliva, tartar forms faster, so your teeth feel dirtier faster. And if you're on different medication is caused right now. And also your family history. If you have parents that had dentures early, you're more likely to get gum disease. People have the susceptibility of the immune traits, and you tend to lose teeth faster. But it's a controllable disease. Just because your family had it doesn't mean that, oh, I'm just going to get it. You can brush, floss, and you'll keep the bacteria off your teeth, and you'll least likely lose your teeth. Over here, I have different oral hygiene aids to show you. There's manual toothbrushes, and there's electric toothbrushes. Let me go around the room, and you tell me what you use. Starting with you. A manual. Okay.
Electric.
Good.
Electric.
Good.
Manual.
Good.
Manual.
Okay. So 2
Two electric. Really manual.
How come you guys haven't tried an electric?
It's too costly.
Okay. There are affordable ones. Manuals are good if you're doing it for 2 minutes, if you're doing it in a circular pattern, but I really, really like an electric. Why? When you wake up, are you tired? Are you lazy? Are you in a hurry? Do you do it for 2 minutes? Most people that clean their teeth, they don't. At night, if you're tired, if you're lazy, 2 minutes? Probably not. So an electric toothbrush does double the work. It vibrates, it spins, there's different brands, different types. Do some research, pick one that works for you. Manual toothbrushes, I'm going to go over how to properly use it. So we're going to wake up in the morning and we're going to brush for 2 minutes, right? But you're going to do your whole mouth in 2 minutes. It's easier to break it into sections. 30 seconds up here, 30 seconds up here, 30 seconds here, 30 seconds here, and that will total 2 minutes. Also, do you know what 90 degrees is?
Yes.
So, horizontal, vertical, that makes 90 degrees. With a toothbrush, you're going to go 45, which is half of that. You take your toothbrush,
Go diagonally.
and you go diagonally into the gum line, and then you start sweeping in a circular pattern. Circular pattern, circular pattern, circular pattern. You have 3 surfaces: cheek side, chewing side, tongue side. The front teeth are a bit trickier. You just have 2 sections. The incisal edge you really don't have to worry about because they don't really get that dirty. And repeat the same thing on the upper left, lower right. Any questions? Okay, for flossing, how many of us floss daily?
Nobody.
Most of my patients will tell me I don't do it enough. I know I should. So you look, you pull out about 12 to 18 inches of floss. You go in between the teeth and make sure that because the teeth are rounded, you curve to each side. You don't just snap it in, snap it out. That doesn't take out the bacteria underneath the gums where the bleeding occurs. You curve it to the side, up and down, curve it to the other side, up and down. Is that okay? Is everybody able to see? All right. So in conclusion, get regular dental visits, brush your teeth twice a day, 2 minutes each time, floss every night. Also, mouthwash. How many of us use mouthwash? Good. I think a lot of us don't realize that, do I brush first? Do I floss first? When do I mouthwash? Any of you know?
Last.
Okay. Do you remember when you were younger and went to the dentist and they gave you something to rinse with and tell you not to eat or drink for 30 minutes? Okay, that's fluoride. Fluoride is also in your toothpaste. This is what I want you to do. In the morning, just brush for 2 minutes, soft gentle circles, use any type of mouthwash you want because you're going to eat breakfast, drink coffee, go on with your day. At night, you want to floss first. It loosens up all the food that you've ate throughout the day. Floss first,
second.
then mouthwash. Floss first, mouthwash to loosen up all the debris that you just flossed. Fluoride toothpaste last. Fluoride is a mineral in your toothpaste that helps prevent cavities. It builds an extra layer onto your teeth to prevent cavities from forming. And that should be it. Any questions? Nope. Okay. See the little letter or the little thing you filled out? Pass it to the person next to you and they'll tell you if you did it right or wrong. You go around. Yeah. So who did it the way I usually, when I talked about it?
Oh. Okay.
Close. Anybody close?
Of course.
No flossing except Eddie.
I put flossing at night.
Okay, we have 2 winners. Eddie and Michelle. Okay. Everybody gets a prize off the table tonight.
All right.
Thank you.
I want electric toothbrush.